So vasomotor rhinitis is a type of inflammation of the nasal passage, which is not related to allergies usually, and is characterized by a lot of watery, runny nose. This usually happens with certain triggers, which can be changes in temperature or eating food, and is not related to other causes such as allergies or a leak of fluid from the roof of the nose. So the first thing that we need to do when we see a patient with watery runny nose is do a few tests to rule out things like allergies or other causes of watery runny nose. If everything points towards vasomotor rhinitis, then the first thing we do is try patients on a nasal spray that actually acts on the nerve that's at the back of the nose and helps to reduce the secretion of mucus. Yes, in fact, there are several options. Some are pretty simple and some are more complicated. The more complicated ones are surgeries under general anesthesia, where the patient is asleep for about an hour to 2 hours, and we have to go and actually surgically look for the nerve at the back of the nose and cut it and put something like a barrier to prevent that nerve from regrowing again. More simple things that can be done are procedures like the ClariFix procedure, and that can be done in the clinic under local anesthesia. And what it is basically using liquid nitrogen to freeze the nerve at the back of the nose, and it could be done in a patient's examining chair after freezing with a spray and then a small needle, and then the patient has an improvement in their symptoms, which comes after a few weeks. It's actually very quick, only taking a few minutes. So the procedure itself is actually very painless. We're able to freeze the nose and to apply the liquid nitrogen without any feeling of pain or discomfort. However, not uncommonly, patients do have something like an ice cream headache for up to 30 minutes after the procedure. And while it could be intense, it usually will go away and is improved by drinking warm tea, which we sometimes give to patients. The results are pretty quick, which can occur within a few days, but sometimes it takes a little bit longer, a few weeks. Usually the effects are long-lasting, usually at least a year, but it is possible that the symptoms do come back in the future and another procedure will be necessary.